Assalamualaikum. Hi, welcome back.
Dah ramai yang tunggu. Sorry, I terlambat.
My next presentation. Okay, now we move to the typical antipsychotic agent, or known as a second generation of antipsychotic. We have clozapine, risperidone, quetiapine, olanzapine, and also aripiprazole. Okay, the mechanism of the typical antipsychotic agent, it can block the serotonin receptor more than the dopamine receptor. And the administration, it can be taken with or without the food. Okay, while the side effect of the second generation is EPS, but less than the typical antipsychotic drug. It also can have sexual dysfunction, postural hypotension, dizziness, anticholinergic side effects, sedation, high weight gain, and also risk to the hyperlipidemia and the hyperglycemia. Okay, clozapine only antipsychotic with the less risk of the EPS and also TD, transient dyskinesia, and proven efficacy for the refractory schizophrenia. For the side effect, it can be the granulosis, which patient need to check the FBC every week. It also can cause the constipation, hypersalivation, dry mouth, nausea, vomiting, and anorexia. And the fatal myocarditis in the first 2 months and cardiomyopathy past medical history of cardiovascular disease must be recorded before starting the clozapine. Okay, the dose is about the adult over 60 years, 12.5 milligram daily or twice daily on first. And then it will be about 20 to 50 milligram on second day, then increase gradually, increase gradually if we are tolerated in the step of 20 to 50 milligram daily over 14 to 21 days up to 30 milligram daily in divided doses. Okay, the trade name for the clorazine is chlorazil. Okay, the advantage is the low APS, low sexual dysfunction, low anticholinergic side effect, but the disadvantage is the high weight gain. Okay, this slide show you the differences between the typical and typical antipsychotic. First is the typical of first generation, which consists of high sedation, low weight gain, high transient dyskinesia, high anticholinergic side effect, and also high sexual dysfunction. While the atypical or second generation antipsychotic may cause a low sedation, high weight gain, low transient dyskinesia, low antipsychotic side effect, and also low sexual dysfunction. Okay, for the caution and contraindication, antipsychotic should be used with caution in patients with a hepatic impairment, renal impairment, cardiovascular disease, Parkinson disease, epilepsy, depression, myasthenia gravis, and etc. Okay, should be used with caution in the elderly who are susceptible to postural hypotension. Second is antipsychotic drug may be contraindicated in a comatose state, CNS depression. Most antipsychotic drugs are best avoided during pregnancy unless essential, and it is advisable to discontinue during the breastfeeding. And then for driving, it can cause drowsiness. So the drowsiness may affect the performance of skills tasks especially at start of the treatment. Effect of alcohol also can enhance the drowsiness feeling. For withdrawal after long-term therapy should always be gradually and closely monitored to avoid the risk of acute withdrawal syndrome or rapid relapse. Summary of the antipsychotic. First generation of antipsychotic can be used for 4 to 8 weeks. If no response, it can be changed to the second generation. Like a severe case of psychotic or bipolar, it can be used to change to add the mood stabilizer. For the second generation, like a clozapine and olanzapine, it can increase the risk of the lipid and diabetes except for the risperidone. To give the least EPS side effect, maybe the patient can use the clozapine. High EPS can be caused by the haloperidol. While the patient experience hallucination, it can be prescribed with the peridol. Patient experience social withdrawal can be prescribed with the risperidol. And resistance schizophrenia can be described for the clozapine. Antipsychotic depot injection. Long-action depot injection are used for maintenance therapy, especially when compliance with oral treatment is unreliable. Depot injection are given by deep intramuscular injection at interval of 1 to 4 weeks. Okay, antipsychotic depot injection, haloperidol deconnated uh, intramuscular every 3 to 4 weeks. Okay, 100 to 450 milligram. Flufenazine deconate uh, intramuscular every 2 to 3 weeks, 100 milligram at one time. Long-acting risperidone intramuscular every 2 weeks. Okay, for the patient information, continue to take haloperidol even though the patient feel well. Do not stop taking haloperidol without talking to your doctor, especially if you have taken large doses for a long time. Doctor probably will decrease the dose gradually. This drug must be taken regularly for few weeks before it is full effects if effect is felt. Patient should know that this drug may make the patient drowsy. Do not drive a car or operate a machinery until the patient know how this drug can affect the patient. Remember that alcohol can add to the drowsiness caused by this drug. Okay. Uh, Next, for patient information for clozapine, please take the clozapine at around the same time every day. Take the clozapine as directed, not to take more or less or it takes it more often than prescribed by the doctor. Clozapine controls schizophrenia but does not cure it. It may take several weeks or longer before you feel the full benefit of clozapine. Continue to take the clozapine if the patient feels well. Do not stop taking clozapine without talking to the doctor. A doctor will probably want to decrease the dose gradually. Alright, okay, this a few literature you can read after this. Alright, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.